Okay, sir.
All right. Okay, starting the timer. And here is the question. All right, tell me, there are two more. Maybe have we done this recently? No.
Trauma
Right,
consultant.
Yes.
No, ma'am.
Doesn't matter. All right, where is it? Okay, next. Can you read it, or is it just coming in your way? And there's one more as well. Yes, please. I'll give you 1 more minute because you can go back and read. All right, I'm giving you 1 more minute, please.
I'm going to write it with.
Yes, take a snap, it will be easier.
Yes, ma'am.
Next page?
Next page, ma'am.
Yes. Right, give you 2 minutes. So if you've read and understood, can we begin? Or do you need more time?
No, ma'am. We can begin.
All right, good, cool. Yes, begin. Considering it communication station, please.
Okay. Hello.
Hello.
Hello. Good morning. My name is Dr. Ishfaq. I'm one of the surgical doctors working under Mr. Peter. I wanted to inform about a patient, Mr. Jones, need a consultation from the trauma consultant. So can I check them speaking to Dr. Peter?
Yes, I'm Dr. Peter. Could you please summarize your case?
Okay, thank you, sir. Actually, we have patient 20-year-old male who came, who was admitted under us as a case of RTA and hit and run case. Initially, patient presented unconscious, but on arrival, patient has a GCS of 15. Patient was admitted on our side. We did few investigations. On inspection, firstly, we see the patient has a right tibial open fracture. Then followed by that, we did few blood investigations that were normal at that time, except his CRP level was a bit high. And we did an X-ray of the both lower limbs that has revealed the tibial fracture on the right side, and we did a USG abdomen as well that has revealed the pre-fluid in the paracolic gutter. So initially on examination, he was hemodynamically stable, and on the exposure, we came to know that patient has abrasions in the left flank as well, and patient has abdominal distension as well. So we are concerned that patient is having open tibial fracture, and we came to know that patient is having pulseless extremities. So we suspect patient might be having vascular injury. So this is our most important concern, and we need consultation and we need further opinion from your side, sir.
Okay, so what do you think is most urgent at the moment, doctor?
Yes, sir. The most urgent we think is the pulseless pulseless limb on the fracture side, because we thought it might be the vascular injury and it is posing the immediate threat to the limb. So we should be given the first priority to the limb.
Okay, what is your plan of management?
Okay, I will manage the patient according to the ATLS protocols, starting from the airway, circle spine, breathing, circulation, and G and exposure, and to manage the fracture in C2. We'll inspect the wound, we'll give the washes, normal saline washes of the wound. However, we will not manipulate the wound, and we would like to arrange a Doppler, this duplex scan Doppler to rule out the vascular injury. And as the patient has having fracture, we would like to put a Thomas this traction and splint. That would be in consultation with the orthopedician. So we'll try to stabilize the fracture. We'll do these investigations, Doppler, to rule out the vascular injury, and do the primary survey and continue the resuscitation from our side.
Okay, so is there any blood investigations you would like to do?
Yes, ma'am. Yes, sir. We would like to repeat the investigation. We have on admission. We have done the investigations that were normal, except the raised CRP level. But as soon as I will be get off the phone, I would like to repeat the investigations: full blood count, urea, electrolytes, coagulation profile, blood grouping, and cross matching, and check the CRP level as well again. And so I will do that as soon as I'll be off the phone.
Okay. What would you want to do for the wound?
So for the wound, we will wash the wound, as it's a dirty wound. It has been grossly gross soil is been there. We will wash the wound thoroughly with a normal saline, and we'll commence the patient on the broad spectrum antibiotics, and then we'll decide further. But as of now, we'll
Okay.
put the patient on broad spectrum antibiotics and wash the wound.
All right. So, how do you plan to fix his fracture again, doctor?
I would like to liaise with the orthopedician, and maybe he will advise us the external fixation traction.
Okay.
Yes,
Why external fixation?
because it is a dirty wound. It's a gross contamination of the wound. So the definitive management won't be good for this patient, as it can be infected later on. This won't be a good thing as an open wound.
Okay. Is the patient wearing any cervical collar?
Good.
No, sir. Patient is, as I have gone through the notes, patient is not wearing any cervical collar, but I will make sure that patient wears one when I will be off the phone.
Okay. Do you think that the patient seems dehydrated?
On my previous assessment, patient was not dehydrated, but I will check again and I will let you know, sir. But previously he was not dehydrated.
Okay. So, why do you think the general surgeon had wanted to do an ultrasonography of?
Yes, sir. As patient on examination, patient was having the abrasions on the left flank side, and as we did a USG abdomen, so he was suspecting that patient might be having some intra abdominal injury, some visceral injury. That's why he ordered a ultrasound to rule out any visceral injury.
Okay. So, who are the people you would like to involve in your team at the moment for this patient's management?
I would like to involve the general surgeon, the anesthetist, orthopedician, the ITU registrar, and the cardiovascular surgeon as well.
Any other?
Anyone else?
Maybe we can also arrange a plastic surgeon as well.
Why do you want to arrange a plastic surgeon? Why do you want to involve a plastic surgeon?
Because the patient is an open this wound, there is some tissue loss as well. Because we may need to for the wound management, we will be needing the plastic surgeon for the wound management.
Okay, but that an orthopedic could also do. But why a plastic surgeon? Okay.
Because patient may need a graft. Patient is
Okay,
having
grafting. All right.
patient,
Yes.
yes.
So, what would you do? How would you manage the free fluid in his abdomen?
As patient is hemodynamically stable right now, I would like to arrange a CT abdomen pelvis in this patient after checking his renal function test.
Okay. So, All right. Why are you calling me now?
So because the patient, the immediate threat is to the is limb because of the fracture, and we're suspecting
Mhm.
patient is having the vascular injury. So immediate priority will be his limb.
All right. What do you think? What could be the cause of the pulseless foot?
So we are thinking there are two possibilities: either the patient might be having compartment syndrome, or patient is having vascular injury. These are
Okay.
the two possibilities they are suspecting.
All right. All right then. Thank you, doctor. Please keep me updated.
Thank you, sir. I would like to summarize the case at the end.
Sure.
So we have discussed it. A 20-year-old male has come to us with a case of RTA. On initial assessment, patient was having GCS of 15. On examination, patient was hemodynamically stable and blood investigations were normal except for the CRP. We did a X-ray of both lower limbs that has revealed the fracture, tibial fracture. We also done a USG abdomen that has showed a free fluid in the paracolic cadera. So I would like to, we'll be stabilizing the fracture and provide the primary resuscitation and primary survey. And I have communicated with you, sir, and you have agreed that you'll be taking care of this patient's limb, as it is the most important priority. Is there anything else, sir? I should do for the patient right now?
No, it's all right then. Okay. Thank you, doctor.
Okay. Okay.
Good.
Thank
Thank
you.
you so
Thank you.
much.
Thank you, sir.
Thank you, ma'am. Thank you, Dr.
Thank
Ishfaq.
you. Yes.
Thank you.
First, we'll begin with Dr. Ulfat. Since you were helping, so you give feedback. How did you feel?
Ma'am, I think he's done tremendous. I mean, good improvement, like very
Yeah,
well done,
improvement,
mashallah.
but I'm not still
And
happy. Okay. The
uh,
first,
and I had to
yes,
ask him extra
yes,
questions to,
yes.
bring out
Ask
the
now.
right
Ask now.
answer.
Bell is gone, but we'll ask.
Okay.
Yes, no, he like, yeah, like the plastic surgeon thingy, like the way he framed it, it felt like okay, the orthopedics could do, but we want the
Yes,
reconstruction and the
yes.
grafting. So these keywords,
They
they
ask.
asking because
They
that's
ask.
what the plastics are
They ask.
involved.
Yes.
Then rest, I think he did really good. Alhamdulillah, he's covered all of them.
He covered.
And
Yes. But for me, the biggest thing was energy level. He will make
energy.
examiners sleep. He'll put them to sleep with this good energy level. This is what we
I
have to
think
do. He should look at the energy level of Dr. Avishek or yours.
Abhishek.
Yes,
Oh,
Yes.
activeness. Come on, he's
Abhishek is
not
a
80 years
ma'am,
old.
Abhishek is a firecracker. We're not going to go there.
Why not?
Definitely, ma'am.
Mashallah.
I should be
Good.
more vocal. I should be more this.
Yes,
I
even
Maybe
think in
Dr.
the
correct.
Ulfat,
winter.
being a girl, she's so active. Like energy
Yes,
level
ma'am.
Thank you
should
so
be
much,
there,
ma'am.
thrill should be there. You are a
Yes, ma'am.
surgeon, you can't just sit and talk like a psychiatrist. That's how they talk, sleepy, sleepy. I need
No, ma'am.
energy.
I was so tired. I was on
I
24 hours
can
shift.
understand
Oh, poor
midnight
man.
at your place, but still,
Yes, ma'am.
energy
Still,
level.
Uh,
I should be more this confident, and I should be more energetic.
And you know
I
what?
promise
When
I will
yes.
when you
be
begin,
from tomorrow onwards. You'll be seeing me more energetic.
Inshallah.
when you begin, try to summarize your whole case in as few words as possible and cover
Okay.
the whole
Possible. Yes,
scenario.
ma'am.
Yes, and
Yes,
Hmm.
ma'am.
as early as possible, you can come to the question: am I talking to whoever? Right?
Yes, sir.
That's what you have to do. Like introduce yourself, not like I am. Just say I'm one of the exam candidate, and I have to talk to Mr. Whatever because I have to update on my case. So like to make it summarize, if you lengthen it, it other person listening person will lose their interest. So you have to use the words which are catchy, and the person who is listening are listening with interest. They're not losing interest, or they're
Yes,
In
ma'am.
not
these
putting.
But
things.
Yes,
but ma'am, initially when we call the patient, we introduce ourselves, but we have to give a bit idea about what we are
yes,
saying.
yes,
Like,
yes,
yes,
but not too
I'm
lengthy. I
Just
said
not
just
too
a
just this
just a
this
short
then
summary, or
just
yes,
just an idea that what is the patient you're
yes,
going to
yes,
talk
yes,
about, and then
just,
immediately, because there is another question, summarize your case.
yes.
So
That's the
where
next case. That's the next question. But like
yes,
even telling you about yourself, try not to. talk too much about yourself. Just like one of the exam candidate, and you have to consider one thing as well. Uh,
Okay.
you may not have exam in the morning. They will inform you, but
Yes, ma'am.
once they tell
Accordingly,
you, once
yes,
they tell
according.
you,
I
then
thought it was
according
more.
to the time, yes. If it's
According to the
morning,
time.
then good morning. If it's afternoon,
Yes,
good day
exactly.
or hello, or yes,
Yes, ma'am.
something which is more
That thing we have to keep in mind. Yes, ma'am.
yes, you have to keep this in your mind, so
Yes,
that
ma'am.
you are present in the time and place. And time is
Yes,
very
ma'am.
important. Yes,
Yes,
very
ma'am.
good.
Yes, ma'am.
But you are improving. Hopefully, we still have too much.
Thank you.
Yes,
Yes, ma'am.
Yes, ma'am.
Hopefully.
definitely.
Hopefully.
Thank you so much.
Inshallah. Thank you, ma'am. Thank you.
Vascular also important. Okay, Dr. Abhishek was telling.
Mhm.
Good.
No, no,
Yes, yes, he mentioned vascular. He
vascular,
Yes, he
mentioned
did. He
vascular.
vascular
did. He
important
did.
in this case.
Yes. Yes. Anyone else want to add anything, or should we move on? No. Okay.